for joining us this morning. This is actually our inaugural taping of a show called Out of the Box. And I hear there's actually another inauguration coming sometime today in Washington, something about a president being inaugurated about 1,000 miles away. But I think people in Newport just really need to concentrate on what's happening here today in terms of this. So the show is called Out of the Box, and a little bit about me is, if you don't know me, my name is Don Harris, and I'm a chiropractor and clinical nutritionist. Probably half of my practice is each, about half chiropractic and half clinical nutrition. And the name of my company is Harris Integrative Healthcare and Nutrition. And I think a lot of people don't really know what integrative means. And in my interpretation of integrative, it's using what's best for the patient. So it's using what's best that traditional medicine has to use. It's using what's best that alternative medicine has to use, whether it's physical therapy, or whether it's personal training, or whether it's acupuncture, massage therapy, chiropractic, nutrition. It's giving patients, it's giving our clients more options, more knowledge to actually make better choices for their health care. Today we're starting with a really easy topic on anxiety and depression. We figured we would just kind of start with an easy topic, but and we're going to go kind of back and forth in terms of what are some integrative approaches to anxiety and depression. When I came up here 3 years ago, I actually wrote an editorial, which I'm sure no one remembers, and I just thought the Northeast Kingdom lacked a lot of integrative cooperation between the healthcare specialties. I think MDs kind of had their specialty and they didn't want to refer out to alternative healthcare. I think North Country Hospital had their little issues in terms of that they didn't want to refer back out to hospitals. I would refer people to North Country Hospital many times, and I would never get anyone to refer back to me. But on the other hand, too, we're just as guilty as alternative healthcare practitioners that someone will definitely need a pharmaceutical, someone will definitely need drugs, someone will definitely need surgery, someone will need something other than what an alternative practitioner can do. And I think alternative practitioners are just as guilty as MDs or hospitals at kind of being territorial and not giving the patient the full experience and making, having the patient make the best choices that they can make. So about 4 months ago, I was sitting around, and I kind of caught this concept for the show that we can have people come in from different fields, from a traditional medical field and from alternative fields, and we can all sit down and kind of go over what our alternative or traditional indications to help our clients or our patients better. And again, that would be more of the integrative approach. So this is our inaugural event, so we're going to make lots of mistakes, so I apologize for it. So what we're going to do is start with some introductions. Again, I already introduced myself. My name is Don Harris. Let's start with Catherine Matheson. Why don't you tell us a little bit about yourself?
Hello, thank you for having me today.
It was tough, but
My name is Catherine Matheson. I work here in Newport for Dr. Les Lockridge. I'm a psychiatric nurse practitioner, which boils down to I can do everything that a psychiatrist does, prescribe medications, do therapy. I also have a PhD in philosophy.
You do? I didn't know that.
I don't tell a lot of people.
Probably a good thing.
Yeah. So that's my background.
Okay. How long have you been working with Les?
3 years.
Okay.
Yes.
And you do strictly the kind of behavioral component of his practice?
Yeah, I'm the mental health portion. We work very closely together, though, which is a luxury that you don't have in a lot of places. We sit down at the end of the day and we can discuss different cases, so we're very fortunate in that regard.
Okay, good. And Les has a great reputation, so you're very lucky to work there with someone who is so well known, throughout the community. So. And
he has a very good sense of humor, which is important because he works with a lot of people with cancer, very ill people, and I work with a lot of ill people. So, right. Yes, very fortunate to work there.
Okay. And I know the woman sitting to my right, no one in Newport knows, because they never see her running all over the town, all over, one minute you're downtown and the next minute she's beating you 5 miles up the road, running, and you're in your car. But Sharon Stewart, as a personal trainer, is very, very well known in this town. So Sharon, why don't you tell us a little bit about yourself?
Well, you just explained to me. You just said it all in a nutshell. No, I'm.
That's it. So you can leave.
I've spent the last 34 years of my life being a fitness guru, or trying to be a fitness guru. I studied for under many, many moons to do personal training. I started off in 1980s when Jane Fonda was around after her, and brought fitness back with me from South Florida, where I got my start from. Mm-hmm. And so a majority of my time I used it with work with kids at mental health. I used it in the schools because there were not a lot of call for fitness instructors in the Northeast Kingdom to be able to make a living. So I took my knowledge and my patience, and I went into the school systems, and I ended up working at mental health for 18 years with children's services. Mm-hmm. It's keeping kids active and taking them out in moving them and getting them to be able to sit down quietly and study, and anyways working in the community. And then that followed through with being a phys ed teacher at Sacred Heart for 10 years. Same idea. We went into the school systems and we got kids moving, and they were taking running and doing life lessons around fitness, so that we introduced fitness to these kids at a younger age. Then you realize that they progress much better mm-hmm. into their teen years because they've already established some exercise history. Like my kids, they were born in a gym, but both my three kids, I was pregnant through both of them and worked all the way up until I delivered, and then I delivered and I was back working in a gym, so they don't know any different than physical fitness.
I would absolutely agree with that.
And it's just become a way of life. But now I found that I'm able to help my friends a lot more. So I'm not so much in the second half of my life, or my next goal is more of a healer. Not a healer, but someone that helps to help you find peace in your life. Do you see what I mean? Mm-hmm. At 53 or 52, I'm 52, it's no longer about trying to stay in a fit body or wanting to be a top athlete or wanting to be a fitness model anymore. Now I look at it like I have the ability to bring longevity to my friends, meaning I can help you fight off diabetes. I can help you fight off heart disease. I can help you be stronger through cancer. You see what I mean? Just by getting out and walking and moving and fresh air and sunshine. These are like huge issues that people take for granted. Mm-hmm. And it has nothing to do with the paying of the cost of a personal trainer, because at this stage in my life, 90% of what I do is volunteer. Because you can't put a price on fitness, or you can't put a price on health. And if I have an opportunity to be able to save some of my friends' lives, or my friend, or my family, then that's worth more money than you could pay me. Mm-hmm. Okay. So I've directed the last year to doing this, to opening classes that are cost efficient, that $3 for a workout, or if you don't have it, that's fine. You can pay me when you have it.
You're very good about that.
And I try to take out objections or boundaries that keep people from working out, because unfortunately, the stronger you are going into an illness, the more likely you are to be able to fight it.
So why don't we do this? Because again, our hope is to have a whole series of topics down the road. Today we're starting with anxiety and depression. Next week may be cardiovascular disease, or gastrointestinal problems, or So we're going to have a whole list of different illnesses that we're going to hopefully have the same people or different people back to talk to. So today is more on anxiety and depression, and you would think that those would be actually very opposite topics. Someone is kind of really high and anxious, and someone is very low in the depression. But from what I've read, actually, they're very, very similar in terms of the neurotransmitters in the brain not firing the way that they should. So, Kat, in your opinion, what is what is a good definition of anxiety? And if someone came into you, how would you diagnose that anxiety, and what pharmaceutical approach would you take? And then on the same line, if you diagnose someone with depression, how would you do that, and what pharmaceutical approach would you take on, like I said, on a traditional standard medical approach?
Well, to me, anxiety and depression are two sides of the same coin.
Mhm.
It is very difficult to tease out what exactly is going on for somebody. Quite often, these diagnoses, anxiety, depression, ADHD, bipolar, they're labels in a sense. So I try to look at the whole person and see what's going on and break it down into symptoms. So are you having racing thoughts? Are you not sleeping? What's your appetite? Have there been changes? Just these basic, it's like I'm a detective trying to get data
Mhm.
so that I can figure out what's going on for the person. And so many, like, for instance, ADHD, people can have racing thoughts. Well, that's a symptom of anxiety. It can be a symptom of depression. There's different forms of depression. There's agitated depression, which is not very good, where people are, basically the neurotransmitters, there's something going on. Okay. We all get anxiety.
And a neurotransmitter is a chemical substance in the brain that
Yeah.
communicates between the cellular structures within the brain.
Yep.
Okay.
Thank you. So we all get anxious. That's kind of, anxiety can be good. For example, driving in a storm, we can all relate to that. You can get anxious, your shoulders come up, your breathing gets shallow. Okay, that's an appropriate anxiety.
Mhm.
Versus if you're just, your mind is just racing and you're having unreasonable fears. I mean, basically, to me, anxiety equals fear in many cases. So
Fear of the unknown,
yeah,
fear of something that's
something
happened.
bad's going to happen, impending doom. And then there's people who just, they inherit that from their family. I mean, mental health stuff runs in families. So you inherit a certain set of DNA and the way your neurotransmitters work. People don't want to be depressed. People don't want to be anxious, but sometimes it's what you're born with.
It's kind of like the cards that you were given.
So how do you work with it? Do you take meds? Do you exercise? Back to your question of diagnosing that, people come in, I try to figure out, okay, what is exactly at the root of this? Are there external stressors? Did you just run out of money? Did your dad just die? Did you just go through a breakup? What's going on exactly? Is this going to be a passing anxiety or depression?
Mhm.
Or is this something that needs medication? And I take medication. I mean, meds can harm as much as they help. And so what I try to do, and I'll finish up here, is see if there's something else that can be done, like exercise or meditation or yoga or changing the way your life is to remove that anxiety or depression.
Is medication your first choice?
No.
No, it's not.
No.
Okay.
I spend half my time talking people out of taking it because it has a lot of side effects.
Mhm.
It can change your brain chemistry, so I really work closely with
Well,
people.
let's talk. What are some of the side effects? If I came into you and you diagnosed me with generalized anxiety disorder, and you said, Don, I think you need to go on this XY medication, like what would be some of the side effects that you would warn me about?
Well, a lot of the depression meds, weight gain, numbing, cognitive numbing. So here's a pill, you're going to gain 30 pounds, and you're going to be a robot and not be able to feel feelings. But, in some cases it is warranted because that's better than what people are experiencing. A lot of the anxiety meds, sedation, don't drive when you take this.
Mhm.
People like the benzodiazepines, people can build tolerance to them, and then they can't go without them. And that to me is scary too. And so those are
Now,
some
is the
examples.
benzodiazepine the same thing as an SSRI, selective
No, it's a
serotonin reuptake
different-
inhibitor? It is different.
Yeah, different
Okay.
class, yeah.
Okay. All right, cool.
Yep. Does that answer your question?
No, without a doubt. And you and I have talked a lot about in what you do in terms of the natural
The endorphins.
endorphins and enkephalins and the different things that the brain and the body produces through exercise. So when you're working with someone and someone comes to you and says, okay, maybe they don't come to you and say, oh, gee, Sharon, been Kat has diagnosed me as clinically depressed. I want to come to you as a personal trainer to ease my depression. But I think that would be a good thing if that actually happened.
Yeah, but they
So-
don't usually
so-
come that easy. Usually, the last thing they want to do is get moving, and 90% of the battle is getting them out to move.
Right.
Once I can get somebody outside, and even myself in this winter with the gray, you have to push yourself to get outside, because once you go and you get your endorphins going, you feel 100% better. It's very easy for people to get very depressed and down, especially this time of year, with lack of sunlight and lack of fresh air or lack of movement, and it seems to combat itself. It's almost like a catch-22. I wake up, I feel bad. I wake up, I don't want to get up out of bed. I don't want to go to class. I don't want to drink my coffee. You know what I mean? It's just like pulling teeth to get somebody to come. You'll feel much better. But they're just they're lacking their endorphins, and that happens to cause a lot of this overwhelming sadness or tiredness.
And that's what I want you to go into, because the body actually makes its own natural
Endorphins,
feel-good
right.
chemicals. You know, obviously we know serotonin and the different neurotransmitters that are made in the brain that are feel-good neurotransmitters. But in terms of exercise, what are the components that the body makes to actually help you with your anxiety and
When
depression while you're exercising?
You release endorphins. You release adrenaline. You get a natural buzz. Actually, you watch people, they leave and they just get a good hard, you're breathing hard, you're just working past capacity, or you're reaching a goal, and you just naturally, you're releasing your own adrenaline or your serotonin. You know, it's like a natural drug. And
So exercise will release serotonin also.
Always. And you know what, even if you just put your shoes on and go outside and look at the sunlight and just walk, it just makes, there's something about it, just releases it immediately. Like I used to say, I was outrunning my demons, and I did it literally. I could run to Sherbrooke, because but I always felt better when I was done. If I came into this spot, and it's natural, it's human nature, where you're stressed out and you just go, okay, do you drink? Do you eat? Do you exercise? Right? You've got your overeaters, you have your alcoholics, and you have your exercise people. Right? It's where you channel your energy to. When you can find that energy and channel it positive, it has a positive outcome. Do you see what I mean?
Yep.
A lot of times, if I took that anxiety or the sadness and said, I'm just going to eat a Big Mac because it's comfort. Oh, it's so good. It's going down. Then after you go, it's almost like a release, right? After you eat it, how bad you feel that you ate the McDonald's and the fries, right? Same thing with the drink. Oh my God, I'm gonna have a drink. It's gonna calm me down. I'm gonna feel a lot better. And then you have 2 or 3, and then you feel awful because you drank 2 or 3 drinks that you didn't need. Or you have my end of it, where you go, you know what? I'm just gonna go out for a run and feel the sun on my face, or a walk, and you come back and you feel like $1 million. And then you go, okay, now I can take on what was ailing me.
Now, do you
Or lifting.
propose that would be something more done in the morning to start the day? Or as long as you do it throughout the day, it really doesn't matter?
It doesn't really matter. I mean, some people are just, like, I'm a morning person, so my day is, if I don't start if I don't start at 6 a.m., it's a habit, and I have my first class at 6 a.m., my day is off. You know what I mean? It's just like I had to cancel for 6 a.m. because of weather or whatever, then I seem to be off all day long. It's just, it's a mental or emotional thing. It doesn't matter what time you exercise, but it's that time during the day where you're going to be able to release all your pent-up frustrations, right, which lead to anxiety or stress, and you just get almost like this brand new breath of fresh air. You know, it really is hard getting there, but once you're there, you feel like $1 million. When you leave, I love to see the smile on people's faces when they leave. If I had a camera and watched everybody walk in and going, do we have to do this
That
again?
would be me.
Right? Sharon, I got the done. And every excuse not to exercise. And I'll check with them and say, where were you today? I didn't see you. This, and this. But then, once they come in, they leave feeling like $1 million. They can start their day. They have energy. That things don't look so bad. And some people prefer to work out at night after a long day in an office when you're at paperwork and you've been
Which is me, as you and I have
Yeah.
talked about. I much prefer to work out after work.
full of coffee and that type of thing, and they just want to get going at 5 o'clock. When or where you do it is totally up to you. Again, it's your lifestyle. I'm taking all objectives out of the way. I'm not giving you any reason not to work out. You want to do it at 5 at night? Fine. You want to do it at 6 in the morning? Fine.
Mhm.
Is one objective gone. You have kids, take them with you. Bring your kids. Make them part of your lifestyle. But I try to remove all barriers from people's
Now,
lives.
can those endorphin enkephalins actually be measured? Can you actually do a blood test and after 20 minutes of an
Oh.
exercise actually measure to see if your endorphins and
Let's
enkephalins
ask-
are actually increasing?
We'll ask Dr. Lockridge to take a blood test on me. Sharon, go out and do your thing and then come back and let us test your blood. And we'll see what it says.
Okay. No, I think it's a good thing to
It will
see if
be
actually
green.
you can actually, are they measurable, I'm thinking, I guess they're neurotransmitters that they can actually be measured once, you do have a workout, so.
We'll have to ask him.
Okay.
He says,
That's
I'm
up to you.
see him after this.
Yeah.
I'll-
say
You're-
yes.
you're more
Sharon
full with
said
them.
she wants a full battery of blood test run to see
Or
if
just
it's
buy my
happening.
beer at Kingdom Brewery and he's fine, so.
That would be interesting.
Yeah, I'll
So.
check it out.
Okay.
I don't know the answer. to
But
that.
also it works if people have headaches. A lot of times the stress and anxiety cause headaches or nausea or just, physical symptoms. And then, they're like, I can't work out because I don't feel good. Well, you don't feel good because you haven't worked out. It's kind of like catch-22. Then you get your endorphins and it's amazing how these headaches
Yep.
vanish or their stomach pain vanishes.
Now, my end as a clinical nutritionist, obviously there's a couple ways that I go. Obviously, with just basic nutrition, what are you eating? What are the carbs? What are the types of fats that you're eating? What are the combinations that you're eating? The two things that I find most important in a lot of the different health issues, not just anxiety or depression or cancer, but the two issues that I find that are just exploding in our country are, number one, the inflammatory processes that are happening in our body. We are loaded with inflammation. And I'm not talking about inflammation where you rub yourself and you're a little bit red. I'm talking about cellular inflammation that you really can't see or feel. And in the brain, if you do studies on the brain is loaded with cellular inflammation based on diet. And a lot of that inflammation is coming from what we're choosing to eat and what we're choosing not to eat. So what are the two most things that we're picking now in terms of our diet? A lot of it is we're substituting a lot of our diet with vegetable oil. Well, vegetable oil is an omega-6 fatty acid. Omega-6 fatty acid is a highly inflammatory fatty acid, or arachidonic acid. It's inflammatory, so it's going to get in the body, it's going to cause inflammation, and not only is it going to cause brain damage or issues, it's going to cause other damage, and this is something we can get into later. So the inflammatory component of the brain being kind of set on fire through poor choices of picking out much higher levels of omega-6s, which are far more pro-inflammatory. There's another word called eicosanoids, and I'm sure a lot of people have heard that. And our decrease in omega-3 fatty acids, and I'm sure you've heard EPA, DHA. And so our arachidonic acids, or our pro-inflammatory fatty acids, are skyrocketing, which is causing a tremendous amount of inflammation, again, not only in our body, but in our brain. And our calming effect, omega-3 fatty acids, especially EPA, I'm sure people go to the store and they look up, the essential fatty acids, and they look, what's in here? They have EPA and DHA in this essential essential fatty acid. Essential fatty acid is a fat acid that comes from fish, mostly. All right, and the ratio probably 500 years ago compared to omega-6 pro-inflammatory fatty acids compared to omega-3 anti-inflammatory fatty acids used to be about 1-to-1. Now it's about 50-to-1. So we're getting 50 times the amount of pro-inflammatory omega-6 fatty acids from vegetable oil and other sources. And we're not eating fish. We're not bringing in good, high-quality omega-3 fatty acids, especially the EPA, and skyrocketing our arachidonic acid, which is creating a lot of inflammatory processes in the brain, which then lead to, obviously, cellular miscommunication in the brain, which can have a lot of triggering effects in terms of how the brain functions. So, and that's one area, and the other one area is refined carbohydrates. As we increase our insulin and our sugar. So we increase our sugars, we increase our insulin, we increase our pro-inflammatory omega-6 fatty acids, we decrease the anti-inflammatory omega-3 fatty acids, and then we wonder why our body is so inflamed. Which is, again, not just causing anxiety and depressive issues in the brain, but many other issues also. So diet, in that way, has a long history being proven in terms of cognitive or anxiety or depressive issues just by the amount of omega-3, omega-6 fatty acids that we take. So something just as simple as adding high levels of omega-3 fatty acids into your diet can have tremendous effects on that also. This is something that you and I agree on, N-acetylcysteine, that we always talk about. And N-acetylcysteine is a precursor to glutathione, which is a really good precursor to liver detox. So again, are we looking at inflammation, or are we looking at oxidative stress? And I'm sure you've heard the terms free radicals and oxidative stress. And unfortunately, with our society today, with all the toxins and the pollutions and everything else that we're taking into our body, not only are we taking in, we're polluted, but we're not taking in the right nutrients to combat that. So you take your diet level of high omega-6s, low omega-3s, high refined carbohydrates, high insulin, and then we don't get anywhere close to the amount of antioxidants in our body. And again, those two things that the research that I've done, not only on other areas of the body, but in terms of anxiety and depression in the brain, again causes what's called cellular inflammation in the brain. And so the cells just aren't talking to one another. So we have to get in there and reduce that inflammation in the brain and the oxidative stress in the brain. And one of the easiest ways to do that is obviously essential fatty acids, but something else that you and I agree with is the N-acetylcysteine. And I know you love it, I love it. I try to get everyone on a supplement of N-acetylcysteine for that reason also. So diet is huge. Supplements that you take are huge. There was a study on, I think it was N-acetyl. It was either L-theanine, which comes from green tea, which changes the alpha waves in the brain, or N-acetylcysteine, and it actually had equal effects on Xanax. So they did this double-blind study, and the effects of L-theanine were as significant as taking Xanax in terms of whatever scales that they use. So supplementation can be a huge part of it also in terms of targeted supplementation. Are you getting enough essential 3 fatty acids? Are you getting enough, are you getting too much omega-6, pro-inflammatory fatty acids? Are you getting enough N-acetylcysteine? And inositol. Inositol is a phenomenal, it's found in our body. It's kind of a B vitamin, and inositol is a product that we can take. And I have a lot of my patients on inositol, and it's the same thing. It's a antioxidant which actually repairs the brain. It's found in us. But one of the things I'm finding out with any of these things that we're looking at, whether it's essential fatty acids, omega-3 fatty acids, whether it's inositol, whether it's N-acetylcysteine, whether it's 5-HTP, is that it's always based on dosage. And I think what happens is that a lot of people don't know really what they're doing, and they'll just say, go to your local store, and I'm not trying to put down Kinney's or Rite Aid. The people who work there are phenomenal. But let's face it, if your house is on fire, and you and I may have made this comparison, and your house is on fire, and you're sitting out there with the hose, water hose, you're doing the right thing, right? I mean, you're putting water on the fire, but are you really going to put the fire out with a little garden hose? You're not even taking close to what you need. So a lot of people will come in and say, well, I'm taking, 1 gram of essential fatty acids, EPA. And I'm like, that's great, but you know what? If you have clinical depression or clinical, anxiety, you should probably be taking 6 to 8 grams of essential fatty acids a day. So dosage is extremely important. I always say if you want to have a clinical effect, you have to take a clinical dose. All right, so if you're going to just take these little amounts, they're not going to have a clinical effect. So depending on what we're using, whether it's, like I said, whether it's inositol or NAC or omega-3 fatty acids, and we've talked about 5-hydroxytryptophan and L-theanine, and there's all these different things that we can take in terms of supplements. But you really need to talk to someone who kind of knows the amounts, and getting an evaluation from you, and then talk to you about the physical, component of it, and then kind of blend all three of them. So, you may want to put them on a lower dose of a medication, and then start working with Sharon, who will then, work with her part of it, with the endorphins and the encapsulins, and then start looking at the other part of it, which would be, maybe giving them some higher levels of essential fatty acids and some other things.
Make sure they do not fry mozzarella sticks in a baby fryer, because that would be combative to what they're doing.
Yeah, probably.
Probably.
Okay.
That would cause, I'm just
Yeah.
putting this together now,
No,
and
no.
now I'm seeing the reasons why my kids act the way they do. Because they should not be frying something that's already fried in another deep fryer.
Oh, it's
In
vegetable
vegetable
That's what
oil.
we talked about. Vegetable
I
oils
had no
are
idea
omega-6s.
about vegetable oil.
Yeah,
I
that's how we're
learn
getting
something
most
every
of
day.
our
Look at that.
omega-6s now.
Well, there you go. That
Which are
explains it.
arachidonic acid, which are pro-inflammatory.
Okay, that's
So-
it. Kids, no more vegetable oil. You're only going to have,
And refined carbohydrates.
And
You
refi-
have to watch the refined carbohydrates.
that's the
because
mozzarella
those are gonna be
sticks,
pro-
deep
pro-inflammatory
fried in the baby
also.
fryer.
To be made
Yeah.
illegal.
Done.
Yeah.
No more.
Good luck with that one. So, but there are many other different things that we can do. Like a lot of people will get, gamma aminobutyric acid and some of the other not drugs, but supplements. I have my own opinion on them, whether they actually cross the blood-brain barrier and actually have an effect. So those are things that we would talk about. We would do an evaluation and look at whether they're actually looking at something that they may be taking because someone suggested it or they read it in a book, but it really doesn't have that much of an effect because it's just not crossing into the brain. Because because a lot of the brain is under a lot of inflammation. But when you take ibuprofen or you take a COX-2 inhibitors, you take a lot of these anti-inflammatories, they don't cross over to the brain, so they're not having any effect on the inflammation in the brain. So you can take all these different things to kind of control the inflammation in the brain, but it's not really going to have an effect. So between targeted supplementation and targeted diet, I think you can have a lot of effect on anxiety and depressive moods. But again, it's getting the right person like you to go through the testing, find out what's going on, how serious is the depression, because inositol is found in the body. It's kind of a B vitamin and it works as an antioxidant, but it's probably not going to help significant depression. Right? It may help mild to moderate type of depression. So I think it would be good for people to be evaluated by you in terms of where they stand, and then look at someone like Sharon to put them on a exercise program that's going to do all the things that she does, and then we can look at the diet part of it, whether it's diet or supplementation. And we're not the only three here. What about massage therapists, acupuncturists? There's many other different alternative healthcare providers that we can bring in, that will help that also. And it's just not the three of us that have have everyone in our ring, and this is the only different ways, the only ways that you can use it. There are other really good qualified healthcare providers that can offer, different alternative therapies for anxiety and depression. So I think between the three of them, what I'm trying to do is give people a choice, and integrate the program. Can you use Xanax along with a really good exercise regimen, along with N-acetylcysteine? And that's something we would have to work together on, and instead of just saying, okay, you do this, you do this, you do this, but then no one knows kind of like what's going on and following someone through because they may be taking other things. So I think that's what I mean by integrative, is that we're all working together for the betterment of the patient, no matter what it is, whether it's anxiety, depression, or whether it's even cancer or something else. And I really hope the community can kind of pull together to work much more on an integrative approach to all different types of healthcare in this country. Like I said, I would love to extend the invitation out to MDs or nurses or people like you who are more traditionally trained to come on the program and work with us on more of a traditional approach to whatever the topic is, and people like you, and like I said, an acupuncturist.
There's nobody like me.
And you know what? I thank
Just get
I
that
thank
for
my
one.
blessings every day for that. I think
Just remember that.
Like Sharon Stewart.
That's it. I'm the original. You will never find anyone like me.
Yeah, my anxiety starts at 4 o'clock in the morning when I know I had to have a session with her at 7 o'clock in the morning. I wake up with anxiety already, deciding, oh my God, I have to work out with Sharon at 7 o'clock in the morning.
You did it
So,
once.
but I did it very good. I don't know if that's proper English, but no, you are amazing, and I will get back on track, you know, in terms of working out with.
It's a lot to more. You know, it's not just working out in a weight room or working out or outside. Or this week we do a lot of aqua therapy. I love the aqua. I have ages from 80 to 16 that love aqua fitness. Aqua Tabata. That to me is the best therapy in the world. It releases. Don't even talk about endorphins, but it releases everything. If you're tented up and your neck is stiff, and you should see, you get into the water and you move, and it almost like a cleanse. I mean, you just feel 100% better when you leave the pool. I had somebody in there yesterday, and these are girls that are used to Insanity and P90X, and they're just boot campers, and all of a sudden they go, water? That's not really a good workout, is it? I go, wait and see. Well, you get in the water, and water's all forgiving. You can get your knees up higher, you jump faster, you move hard through the water, and then you just don't feel like your body's being attacked like it is when you're jumping on land. You get out of the water and you feel 100% better. Like you feel like a new person. Nothing hurts you. Everything's like, you just like been cleansed.
Where are you doing that?
In Freedom Therapy,
okay.
yeah. And in the summertime in my pool, and every 4 weeks in Mexico.
Donaritas.
I'm telling you, when I started to live the second half of my life, again, I came back into longevity, right? My jump squats don't look half as good on land as they do in the water. Do you see what I mean? When you're leading an exercise class on land and you go, oh, I can't do a burpee, you hear everything crunch, 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 crunch all the way down, right? In the water, you don't feel anything. Your knees are up to your chest, you're pumping, you're moving like you're 20 years younger because the water supports you. But you're working 7 times against the resistance of the water. So you're getting a really good workout. It's just not taxing your body.
What's it called? Tabata?
Well, it's one of my classes I teach is called Aqua Tabata.
Okay.
And Tabata...
And that would stimulate endorphins.
Endorphins immediately, and I'm going to explain why. Tabata is a form of exercise, and it's been brought to our attention by exercise physiologists through our trainings. And about 4 or 5 years ago, at a training I went to with Mindy Murilli, she discovered this Tabata workout, which has been around forever and ever. But Izuto Tabata is a exercise physiologist who traveled to Japan to train the Olympic speed skaters. And what he did is train them to go 20 seconds all out and have a 10-second recovery. Whereas an aerobic activity like walking, running, biking, that's a consistent flow of oxygen, right? So you go, okay, she's going to kill me for an hour, so I'm just going to take my time, right? Where in Tabata, you go as hard as you can, and you get knowing you're going to get a 10-second recovery. So you push yourself a little bit harder.
Notice that 10-second recovery.
Yeah. I did say I give a 10-second recovery, right? Because not always. Only when I feel needed. But anyway, so the theory behind Tabata is that you want to go extreme, like it's excellent for training athletes. For example, soccer players. You have the soccer ball, you're sprinting, you've got the ball, you're going down the field as fast as you can. You're out of oxygen. You're in an anaerobic threshold, right? Mm-hmm. That's the Tabata where that comes in. That's what helps those athletes learn to pull oxygen. You know what I mean? Yep. I've got it. Here's a 20-second sprint. You can do this, right? So what we've done is taken this Tabata and expelled it into the fitness field. Tabata, running Tabata, cycling Tabata. You can use Tabata for any form of fitness instead of long-term aerobic workouts. You follow me?
Yep.
You can ride a bike outside on the bike path for 45 minutes, and your Fitbit can say 300 calories. Or you can do a 45-minute spinning class done Tabata format. So if you're doing that with me, I'd be on your bike going 20 seconds, all out sprint. on the bike as hard as you can, and you'll be like red in the face, breathing heavy, then you call 10-second recovery. So that's where the difference comes in.
I just wish your Tabata wasn't like at 9 o'clock.
Yeah.
Because
Or they call
at
it.
7 o'clock, it's like, really, don't want to get up.
Is that ciabatta, Sharon? No, that's bread. No, talk to me. They have, it took the longest time to bring this to everyone, but it works in all different levels. Now, not all my classes are Tabata, but I use Tabata as a base training in the water classes for more, what do we call it? More higher energy, high intensity workout. So in the pool, you're going to go as hard as you can in the water. Push, 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 push. 10-second recovery. Right? So however hard you are in the water, you'll feel that you want to be breathless. Okay? And then on another class that you could teach, that I teach, is just the 90-second intervals. So you're going to pace yourself a little bit. Same exercise, only you're going to do it for 90 seconds and get a 30-second recovery. Do you follow me?
Yep.
It's not Tabata. It's just called high intensity interval training, HIIT. There's different forms of it, but this Tabata, to me, encircles everybody. It's easier for people to understand 20 seconds of a workout than to say you're at 90 seconds. I mean, if I approached you and said, I'm going to work out with you, and you have to do a jump squat for 20 seconds, and I'm going to give you a 10-second break, that's doable. But if I approached you and said, we're going to do 90 seconds, and you might get a break, but you might not, you'd be like, oh my God, she's going to kill me. So that's why I feel that the working with the Tabata workout is a lot easier to access more people, because I don't think it's so threatening.
Okay.
Does that make sense?
Yeah, absolutely. So,
But then on the same benefits, a long-term walk is aerobic. Aerobic, sweating to the oldies class that I teach. It's all dance. I put the oldies music on. Actually, I call it sweating with an oldie now. I've progressed to the older stages of my life, so I don't kick my heels up quite as high.
my picture isn't besides that yet either.
Yeah.
So it's
Anyways,
coming, I'm sure.
So
but-
there's a different form of aerobic activity, and that is a longer duration, stays with you longer, that type of thing.
Kat, so if someone is coming to you, and what do you think are like at the top, and I hate to say this, but like what are the top 3 antidepressant or anti-anxiety drugs that are being prescribed today? I mean, I think probably most people have heard of them, but like what are the top ones that are actually being prescribed?
Well, there's newer ones coming out. There's things that they're called SSRIs, things like Celexa, Prozac, Zoloft, Paxil. Then there's another class above that, meaning it works on more neurotransmitters, which are called SNRIs, Effexor, Wellbutrin.
More neurotransmitters or different neurotransmitters?
They
Or
all
both?
work on serotonin.
Okay.
And then norepinephrine they work on. So yeah, Effexor, Wellbutrin, and now there's newer ones coming out that I'm tending to go to because there's not as many side effects, like the weight gain and the sedation with these older ones that work on multiple agonists in the brain. So they basically cover up our brain eats neurotransmitters, kind of. We absorb them. That's how that's
Right,
a
almost
rough
immediately,
term. Yeah. So these drugs, they block the absorption process of the neurotransmitters. So serotonin, Prozac blocks the
That's why
brain's
it's serotonin reuptake
reuptake.
inhibitor. It's
Yeah.
inhibiting the reuptake of that drug back into the neuron.
Thank you. Yes. So those are.
I guess I did pay attention to in medical school at some point.
And then there's mood stabilizers, which are prescribed for what is called bipolar, which I think is a whole series of dis-ease or.
Is there a relationship between anxiety and depression and bipolar? I mean,
Yeah, and it's really difficult to tease out because someone could come in and be like, I'm not sleeping, I can't eat, and I think, is that anxiety? Is that someone who's in a manic phase of the whole bipolar spectrum? We're all bipolar. If you're human, you're bipolar. You're going to have mood changes, okay? Do you need a medication for that? Or can you exercise? Or can you eat properly? And so I always see drugs as the last resort. And again, sometimes I used to work
But you must get a lot of resistance, I'm sorry, because in my practice, trying to get someone to change their lifestyle, as you know,
Oh, yeah.
is almost like pulling teeth. So when someone comes in and you're telling them all of this and say, well, I'm not going to give you the drug. I want you to go see Sharon Stewart, and I want you to get up at 5 o'clock in the morning. I want you to do the Tabata, blah 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 blah, and I want you to start eating, giving up your sugars, and I want that's going to be a challenge.
Well, and you see this probably. It's like I think people think, oh, I can't exercise, but it's just starting small. Like I love when you said just go outside and feel the
That's it,
sun
just
on your
go
face.
outside, yeah.
And then go, oh, I feel better. So it's, and also giving people more control over their life. In this society, I think we all feel kind of helpless and powerless a lot of the times, you know, and with our bodies and with the way things are. And so just to connect someone to you and help them get that confidence and, oh, I do have control over my body and my moods, or connecting to you. Oh, you know what, I'm feeling a lot better since I started this supplement. It just, that helps people's mental health, having that sense of, oh, you know, if there's a problem, so many people, oh, I can't deal with this, it's too much for me. It's, being able to look at that problem and say, you know, I can change this in my life, I can leave this relationship, I can get a new job, I can and I do that a lot with people. What can you do in your life to change the way things are? But people come to me and they want a pill, and that's the
Everybody
society.
wants it immediate. And
Yeah.
yep.
And I try to tell people that, and it's really, that's the trickiest part of the
It is
job.
the trickiest part.
There's in with all of us, they want instant gratification. They want instant results. They want me to be able to give them a pill that's going to make them lose weight, or they want me to come up with a magic recipe for this. There's no magic recipe.
It's
work. And you know what? The ends justify the means. I keep telling them that. It doesn't kill you, it will only make you stronger. And it's just getting people to realize there's no quick fix. If there was a quick fix, we'd all be in Washington right now.
There's a real well, there's a huge that was good. There's a huge emphasis on being happy in this society. We have this pressure to be happy, and what is happiness? I mean,
Subjective.
Yeah.
I mean, we all have life is difficult at times, right? It can be very difficult, and we get these moments.
You and I have had many conversations
Yeah.
about that.
But there is this pressure to be happy, and you know what? Take a pill and you'll be happy. It doesn't work that way.
Everybody wants the easy way out. So it's hard. It's hard for me to, when I work with people and I get so many excuses, or I can't do it because of this, and I can't do it because of this, and I've got this, and so like I told you, I started off trying to take away all barriers, but people really have to be ready for you. They have to be willing to change. They have to be willing to commit. I call it consistency, accountability, that type of thing, and it grows over time, but few baby steps grow into bigger steps. They understand how much better they feel, but it's that instant.
Sure.
I walk into you, I want you to make me feel better. If I go see you today, I'm pretty sure you're going to fix me, and I'll be happy as a camper all day. This is our society.
Now, have you noticed a generational? Because a lot of times I look at kids today, and they seem to be more willing to do things more naturally than some of the people who are maybe a little bit older, because that's all they knew, 30 years ago was the drugs. And now there's other things. The alternative market has increased dramatically. So do you see that maybe people, at least in your practice, are willing to try more alternative therapy than just kind of jump right on the pill bandwagon, or do you feel it pretty much it really hasn't changed?
Well, I think people are just with the internet, and which has its positive and negative side, but that information is out there more, so I think people are more open to. But then on the same note, they come to me, they're like, "Oh, I read about this, mushroom, and if I take it, and I'm like, I don't really know about that, but so maybe go see.
Just Google it. What will this do to me?
Yeah, and so there's a lot of misinformation out there, but that's when I would refer someone to you. I mean, with regard to nutrition or herbs or supplements,
And in terms of referring back and forth, I mean, obviously you would have to have them fill out a medical release of records so I can talk to you about things. So I mean, it would all be done legitimately through HIPAA.
Yep.
That if you want to refer someone to me, we would get the right the right paperwork filled out, and vice versa. If I'm referring someone to you, they have to sign the right paperwork. So there are rules and regulations in place of who I can send someone to based on HIPAA regulations. So it's not a problem. It's just something that we have to be aware of.
and
That's
which
all.
would then allow us to discuss the person.
Sure.
Whereas until that stuff is in place, you can't
Right.
work together collaboratively. Oh, I want to work out with her so bad.
No, you don't.
Yes, I do.
Oh, come on. That's the first person that's
Okay.
ever said
All right,
that.
all right.
Oh, you made my
All right.
whole day.
We will, when you want to work out with Sharon, I will work out with you, okay?
Okay.
I will join you. Oh,
Okay.
stop it.
Okay,
Stop
so
it.
ready for this? Now I'm
Yeah.
going to wait till I'm 80 before I see this. Yes, Don, I'm sure you're coming to work out with me. I'll put that on my schedule.
I'm putting it all on her.
Pretty sure he'll be like, oh, yeah.
I'm putting it on her. When you talk to Sharon and you say, I'm going to work out with you, I'm going to try the Tabata, I'm going to try this exercise routine, set up an appointment with Sharon. Sharon will call me, and we will meet Sharon together, and we will do it
Deal.
together.
Well, I do. That's the other thing that's really positive is small group trainings. Small group trainings fit into a different realm. As I grew older and really started to look at my area and what we're working with, a gym has its calling. A gym has its gym and people that like being in a gym. An aerobics class has its calling. A Zumba class has it. I love Zumba. I can't do Zumba. I cannot dance. I cannot follow somebody else. I am a mess in a Zumba class. And I get in everybody's way and people want to push me. I love it, right? But this is not my place, right? There are people that don't feel comfortable with more than 4 people in a group. Small group fitness classes are my main focus. I take 4 friends and put them all together. They're all friends. And we create a workout that they enjoy doing. Do you see what I mean?
Yes.
That is the secret to success because it's a group. You know what? It's a group effort. One's not going to let the other one hang because they'll be like, Sharon's not going to do it for 3 of us. We need to have 4. Do you follow me?
Yeah.
And then you can tell me, what is it you want to do? What are we working on? Are we working on core? Are we working on cardiovascular? Are we working on becoming strong? What is it we want to do, right? And then it's that class is just for you. It's not personal training as such as a personal trainer is. People think is way too expensive because I don't think I've ever charged anybody for my services.
I don't think you have.
I think seriously, if you ever ask me what I charge, I don't think I've ever put a number on it. Just if I can help you and just get you started and you're on the right direction and I can put you into a fitness program, that to me is worth it. You know, I've seen kids that I've worked with a boy that came to me as a 15-year-old and wouldn't stay with it, came back 3 years later, overweight, couldn't get into the Army. But he was ready this time. And we worked, by God, we worked all summer. And he kept saying, I don't know how to pay you. I don't know if I can afford this. And I said to him, your success in the end will be the reward itself. But you've got to get to this point, right? So you got to trust me. And by the end of the summer, he was almost 65 pounds down
Whoa.
and got right into the Army. He left January. That was all the money. That to me was the best reward or paycheck I could have ever,
Absolutely.
received. Yes, he was mad at me 90% of the time. Yes, he screamed at me many, many times. Yes, he yelled obscenities running. But you know what? In the end, his goal was achieved, and we got him there.
Well, my guess
So-
your obscenities were louder than his, so.
That's right. Anyways, but do you follow me?
I do.
This is what it had. He had to be ready to work to get his goal. At 15, he wasn't ready. So when 18 arrived, he was ready. I don't want to be heavy. I don't want to look this bad. I don't want to feel this bad. I want to change. Then you need to be accountable. You need to be consistent, and you need to listen and agree and follow through.
Wow, that's
Right?
Well, I think Todd back there is probably kind of like trying to wrap things up in his brain here.
Todd!
So why don't we? Is there anything else that you want to?
Well, I've
Address,
never
talk.
met Sharon until today. I've heard about you. I feel like I'm meeting a legend.
I've been called a legend, but
You
not
are-
in very many nice terms.
But so many of the people I see talk about you and how you've influenced them positively. So it's nice to meet you, and I'm going to come work out.
Well, there. See, then that's what, like I said, in the second half of my life, these were my long-term goals, is how can I make a difference? I went up until 45, well, I was 40, and worked for DCF doing foster care and trying to make a difference. And I always told my son, my kids grew up with it, and I often wondered if it hindered them or helped them. But I believed it helped them to become nurturing and more comforting adults. In this process of working with these children, I said God was good to us, so we need to give back and help change lives, right? So we did. And then in this process, we were given a new life to work with and to be able to change a life. Like I call her the stork delivery. She was dropped in my lap when I was 47, and I adopted she was 5 years old when she was finally adopted, but we got her when she was 13 months old in custody. And that was changed my whole thought process on what my goals in life were to be. And it no longer had a financial number on it. Do you see what I mean? My whole persona changed in a different direction. You can't put money on this child's life, you can't put money on well-being, and you can't put money on happiness, right? And if I can bring this into your life, then that's worth my while. That's what I'm here for.
Mm-hmm.
You know, at my age, I'm not going to be rich. Personal trainers are never rich. If they ever say you want to make money, become a personal trainer or own a gym, it's
Not gonna
crazy.
happen.
You have to it's a passion.
Mm-hmm.
And once you can share that passion with people, you see the rewards. You see what I mean?
Okay.
And I even like treats, like chocolate or cookies that people bake for me that bring in,
You never bring me them.
I'll take anything. You want to trade? I trade massages. I trade everything.
Well, why don't we wrap this up? I think we're kind of coming to the end of the hour. And a couple of things that I just want to address is if anyone out there has any condition that you're actually concerned about. Obviously, today we talked about anxiety and depression, but if cancer or irritable bowel, Crohn's disease, diabetes, other neurocognitive issues, we have a whole range of illnesses that we can talk about and blend a integrative approach to it. So if anyone is out there listening and you want to address a certain topic, then call me, call one of us. I think Todd will have our numbers, our names and our numbers scrolled, at the end of this, so they can pick up the phone and call. So if there's any health concerns, any issues that you want addressed in the future, we have about the next 3 or 4 covered. But we'll be more than happy to kind of integrate that into our program. And the second thing is that again, I would love to have a variety of people, especially in terms of the medical field, because I think that's going to be more the challenge. People from the hospital, people from MDs or DOs, kind of coming in and giving their take on it. Not that I think there's anything wrong with that. I just think that maybe their timing, they may be busier. But if there's someone out there who would love to kind of represent more of the medical field and Kat can't make it, I would love to have someone else or other people even. Again, massage therapists, acupuncturists, whatever, who want to be a part of this. You can contact us also. So again, this was our first kind of an inaugural taping. Hopefully, this will do well, and we'll have more and more every 2 to 3 weeks, and we can keep on going with this. I appreciate everyone's feedback that you can give us. We'll try to promote it as much as we possibly can, and we'll just kind of go from there. So I appreciate everyone sitting in and listening to Kat and Sharon. I know Sharon was a little bit challenging to listen to at times, but she means well, and we kind of allow her to out of the house every few hours to do what she needs to do. But anyways, thank you for listening, and if you have any feedback, any questions or concerns, please feel free to call any one of us. And I hope you learned something. I always say when I go to a conference, if I can take one thing back from that conference and help myself or my family or my kids, and I consider it a successful conference. So if you can take one thing from here that will benefit your life or someone else's in your life, then I think it would be a successful show. So again, any questions, give us a call. And again, thank you very, very much for staying with us and listening. So.